Hello again, this is Dr. Ronald Ritchie. I'm speaking to you today about, are you a pain in the neck or a pain in the buttock? Well, this is about disc problems and sciatica. What is the cause of neck and back pain? Wow, how long do we have? Well, arthritis of various forms are one of the more prevalent problems and increasing with more people experiencing it and it occurring at younger and younger ages. Osteoarthritis is what you might call wear and tear arthritis. It can be localized to a specific area or it can be generalized to many joints in the body. Rheumatoid arthritis is getting more and more interest generally because more and more people are starting to experience the autoimmune condition called rheumatoid arthritis. It is an arthritis that damages more the soft tissues around the joints, but then the bone of the joints begins to deteriorate and react to that immune system process and creates these rheumatoid problems. Most of the time you can see that, and you can see it very easily in people's hands. Although there are many individuals who are now starting to experience rheumatoid disease at younger and younger ages. Degenerative arthritis is almost always the result of some type of an injury. You see this a great deal in the knee because we have that damage to the cartilage mostly on the inside, the medial side of the knee, in which the cartilage is torn by one activity or another, and then the joint deteriorates because of the trauma. And then there are post-traumatic forms of arthritis that are a direct result of injury to the joint and not just repetitive small traumas of the degenerative type. Injuries and strains, like I said there, can cause all kinds of back pain that don't involve arthritis. And we see this with ACL injuries to knees in football players, strains to shoulders in baseball pitchers and basketball players. And we also see this in our neighbors and ourselves where we strain and sprain our backs and our necks from various activities around our home and on our jobs. There are also metabolic diseases and dysfunctions that can cause neck and back pain that may have some connection to the spine or may have no connection to the back at all. It's interesting how sometimes people will have sinus problems or tooth problems and they'll be reporting neck pains and headaches. And what happens is when you get into the office and I see them, I can't find anything really wrong with their neck. And I start asking about their sinuses and find out that they have a sinus infection, and that's causing the neck pain or headache. And the same thing is true with the middle back and low back. I had a patient just recently who was having mid-back pain, and what was causing the person's mid-back pain was a gallbladder disease attack, and I had to send them to an abdominal surgeon who then took out their gallbladder and resolved their back pain. So there are metabolic diseases and dysfunctions that can cause neck and back pain. And then internal organ problems. As I just mentioned, gallbladder disease can sometimes cause back pain and very frequently starts as back pain, but also things like appendicitis, kidney infections, prostate problems, uterine problems, ovarian problems. These various internal organ conditions can cause back pain as one of their initial presenting symptoms. Well, what is sciatica? Sciatica, can it be just any old leg pain? And the answer is no. Sciatica is a very specific condition, and not just any leg pain is sciatica. There is a condition called pseudo-sciatica, which means false sciatica, that is more common than true sciatica, because true sciatica comes from nerve root impingements or pinched nerves in the spine. And it has a specific characteristic pain. It is a pain that usually, interestingly enough, has very little low back pain associated with it, but the pain starts right where you sit at the base of the spine at a place called the sciatic notch, which you can see right there in this picture, and it runs down the back of the leg and right down into the foot and toes. It's usually very what's called lancinating. That is very sharp and severe, and it's just a pain you wouldn't wish upon your worst enemy. And it comes from nerve roots being impinged or pressed on by disc bulges or by other types of problems where impingement occurs within the spine. It doesn't necessarily have to be a herniated or a protruded or a bulging disc. It can be from things called stenosis. It can be from degenerative arthritis in these little knuckle joints back here, the facet joints of the spine that affect the nerve roots. So it's always the result of some type of nerve root pinching or impingement, but not always because of a disc problem. Well, what is a slipped disc? People come to my office and tell me all the time, I've got a slipped disc. Well, honestly, there really is no such thing as a slipped disc. Discs don't slip. They bulge, they protrude, they herniate, but they don't really slip. I think sometimes what doctors have done is dumbed down the ideas that occur of things that occur in the body to make it more understandable to normal people, and I think that's condescending. I think that's improper. What happens is a disc is injured. It is deranged. It's got a problem, and most of the time it's swollen, or it's torn, or it's bulging, and it's mashing on nerve roots, impinging or pressing on nerve roots, or causing other inflammatory problems, and that's what's causing the problem. There are multiple causes for slipped discs or disc problems in the spine, but what happens is they compress or impinge nerve roots, and here you can see an illustration. This is a little bit of an over-dramatization of what the problem is, but this would be the evidence of a prolapsed or herniated disc in which the disc is torn and actually disc material is extruded out, squished out into the spinal space. And when that happens, if it's like this, well, the only thing that can fix it is surgery, because you've got to get that material off of the nerves and off of the spinal cord, or it'll cause permanent damage. Discs problems can occur in the cervical spine or the lumbar spine, the neck or the low back. They can occur in the middle part of the back, but they are very uncommon in the thoracic spine or the middle back. It's mostly lumbar spine, then the cervical spine, and very rarely the thoracic spine where these disc problems occur. Well, what are our treatment options for sciatica and disc problems? Well, first of all, there's medications, the classic treatment that most people undergo. That's anti-inflammatories and steroids. Those, you can get the anti-inflammatories. Those include ibuprofen and naproxen. And there's other prescription medications all the way up to steroids like Medrol dose packs and things such as that. And that is very necessary at times, but not always the right answer. There are analgesics, pain medications, and really that's probably one of the worst options, because analgesics just make you not feel the pain. It doesn't solve the problem, and many times if you kill the pain well enough, you actually cause yourself more injury and more harm by continuing to do the very things that are causing the damage to increase. And the last one is antispasmodics. Those are muscle relaxers. And really, honestly, muscle relaxers, in all the years I've been doing this, provide the least benefit. The best benefit of a muscle relaxer is to help you get a good night's sleep, because you do need a good night's sleep anytime that you're having back pain, because our bodies only heal when we sleep. Another option is physical therapy. And physical therapy has its benefits and has its values. But when you're talking about disc herniations and sciatica, physical therapy is a very hit or miss proposition. It can help, and it may not help whatsoever. Another form of treatment are injections, and these are ESIs, or epidural steroid injections, trigger point injections, facet injections, rhizotomies, and all kinds of other things where analgesics and steroids are injected into various areas of the spine in order to stop the inflammation that's going on in the nerve roots. These injections have about a 50-50 probability of doing any good. Most doctors will tell you that. And then surgery. Surgeries include laminectomies, discectomies, IDETs, they don't do very much anymore, rhizotomies, and other procedures. There are some very good microsurgical procedures or very non-invasive or low-invasive quality surgeries that can have a lot of good. And I have sent my patients to have surgeries for severe disc problems where conservative forms of care just don't do enough. Well, what do we have if these don't work? And really, honestly, what's the better way of doing things? Well, chiropractic is different. Chiropractic includes a holistic approach, and holistic means you treat the unique properties of that person. You treat that person, that whole person, not just the back pain, not just the leg pain. You treat the whole person. You have to find out what is going on with that individual and how to help them. Are they very deconditioned? Are they very overweight? Do they have a very bad diet? Are there other genetic or familial characteristics that need to be addressed in some way in order to help them get through and get past this difficulty? You have to look at past health events. If somebody's had back pain events 8, 10, 12 times, well, guess what? There's a lot more that has to be done to help them than just a cracking of the back. You have to look at current health problems. A person who has no associated health conditions at all will recover much faster than a person who, say, is diabetic or has COPD or, say, has rheumatoid arthritis. That's going to complicate things a great deal in treating that individual. But they all must be addressed, because just throwing some medication at them or doing physical therapy won't necessarily help them get better. And not all treatments work. And that is something that many doctors and patients need to understand. Not all treatments work for every single person. If that were true, then why do we have 25 or 30 different blood pressure medications? If one treatment worked for everybody predictably, all we would need is one blood pressure medication. But that's not the case. And that is true when it comes to back pain and disc problems and sciatica. Not all treatments work. I would have to say that when I treat patients in my office for disc problems and for sciatica, I get about an 80% improvement rate, but I've got about 20% that don't get well the way they should. And those 20%, those are the ones that I refer to other doctors for those other approaches, including surgery. Well, chiropractic manipulative treatment is the main weapon of the chiropractor. That's the main tool that I use to treat spinal problems. When you manipulate a vertebra, there are three predominant impacts. One, it's an impact on the manipulation impacts the disc and facet joints by improving their relationship and their posture to one another. The second thing is it relieves the pressure off the nerve roots, because once we get those joints moving correctly, then what is causing the disc to herniate, what is causing the nerve to be impinged, will begin to relieve. And then you improve overall spinal biomechanics, and by doing that you give the body's the best opportunity to heal and repair completely. We also use exercise. I do physical therapy in my office, but I don't do traditional physical therapy. I'm not going to have you walk on a treadmill, and I'm not going to have you lift weights. Not in my office. I'll try to get you to do those at home or at a fitness center someplace. But in my office, the physical therapy is specifically designed to address the most acute problem with that disc or with that nerve root issue, whether it's the neck or the lower back. The other thing that I have found works tremendously well for disc problems and nerve root impingement syndromes in the neck or the lower back is spinal decompression. Spinal decompression is a tremendous advancement on the old traditional type of traction idea. I have found that 80% of people improve, and I have in the 20 years I've been doing spinal decompression, I have not had a single patient who didn't get some type of improvement with the problem, whether it's the neck or the lower back. The thing about it is that spinal decompression can be very specific. It is targeted to the specific area, right down to the vertebral levels that you're trying to decompress by changing the angles, the positions, and how the decompression is applied to each individual. That's those unique things that you have to address when working with an individual who has disc problems and nerve root impingements. Well, whether you have a pain in the neck or a pain in the buttock, chiropractic has a 110-year track record of being able to help those problems. 110 years. Chiropractic originally was codified as a form of healthcare in 1895. That's a pretty good period of time and a pretty good track record of helping. There are literally millions of people who get chiropractic adjustments every day, and the vast majority of those are for back pain, disc problems, and nerve root impingements. That's where I can help you. And if you want to call me, please do. My phone number's on the website. I'll be glad to talk with you about what's going on and how I may be able to help. And if you're in the neighborhood, stop by. Come by and see me. I'll be happy to talk with you. Sit down and see what I can do to help. That's what I like to do. I like to treat people. Been doing it for nearly 40 years, and I would like to help you too. Have a good day. Bye.